As a nurse, I've spoken with patients fighting silent battles, from panic attacks to chronic pain, from invisible illnesses to exhaustion no one can see. And too often, before we even offer a diagnosis or treatment, the thing people need most is something simple, just to hear, "I believe you." Hi, I'm Frances and I'm a nurse, but more importantly, I'm someone who spent years listening to patients in some of their most vulnerable moments. And if I could go back and whisper something to every person sitting in a hospital bed, waiting room, or therapy session, it would be this: you deserve to be heard, fully, completely, without judgment. This video is about something I believe could radically change the way we heal. It's something simple but powerful. What do we mean by validation? Validation is recognizing someone's feeling or experiences as real and understandable without trying to fix, judge, or minimize them. Let's talk about why we wish more people in healthcare truly understood this. Validation is not about agreeing with everything someone says. It's not saying, "Oh, you're right." It is saying, "I see you, I hear you, what you're feeling makes sense." And that one moment, being seen, can change everything for that person. Even training as a nursing student, we learned so much about vitals, medications, protocols, guidelines, but what we don't learn enough is the power of saying, "That sounds really hard." Because when someone's in pain, physical or emotional, what they need first is to feel believed. So whether it's anxiety, diabetes, chronic pain, depression, or long-term diseases, invisible illnesses that don't always show up in blood tests or scans, people often carry more than just the illness. They carry shame, self-doubt, and the fear of not being taken seriously. I've seen patients cry, not because of pain, but because someone finally said, "I believe you. I know you're not making this up." And here's what's happening in the body. When we feel invalidated, our stress response kicks in, cortisol level rises, the body tenses. When we feel validated, the reverse is the case. You see it in their shoulders, their breathing, the way they exhale, that sigh of relief when someone stops trying to fix them and just acknowledges their truth. Validation signals safety. It helps the nervous system calm down so real healing can begin. When people feel validated, they ask more questions. They speak up. They become partners in their own recovery. And it's not just in therapy or psychiatry. I've experienced this firsthand. I once had a patient with unexplainable pain and fatigue, seen different specialists, yet no answers. But the moment I sat down beside her and said, "I know this is real for you, even if we can't explain it yet," she cried, not because of the pain, but because someone finally saw her. Another time, I was looking after a patient who had long COVID, but he said to me, "People often say you look fine," but he didn't feel fine. He was anxious. He had fatigue all the time. And I said to him, "You don't need to look sick to be unwell. You are not imagining this." That moment gave him more peace than any prescription or treatment could. Did you know that oftentimes people, even well-meaning friends, family, or healthcare professionals say things that hurt to patients without even realizing it? And when people hear this, they feel dismissed. It delays healing. It makes them stop seeking help altogether. I'll give you an example of unintentional validation, even from the most well-meaning people. Things like saying, "At least you've not got it worse. At least it's not cancer. You've got to stay positive. Other people have it worse than you." It's probably just anxiety. Try to relax. You're overthinking. But your scans came back normal. You're fine. What do you think these phrases would make someone in this situation feel? It would make them feel small or unheard, or even ashamed of their struggles, of their pain. But what can we say instead to make it right, to make people feel safe? We can say instead, "That sounds so hard. How can I support you? It makes sense that you are tired. You have been through a lot. I don't fully understand, but I believe you." When we say things like this, people finally feel seen. They feel heard. And that's the power of validation. So whether you're a nurse, a family member, or just a friend, here's how to validate someone who is struggling. First of all, you listen fully without judgment. You don't interrupt or try to fix the person. Secondly, you reflect on what they have said. It sounds like you are exhausted or scared, and then you acknowledge, "Of course you're feeling overwhelmed. Anyone would. Let's work this out together." Because when you dismiss people, it doesn't protect their system at all, and it breaks that professional relationship. It breaks trust. What I wish most patients heard: "You know your body better than anyone. Let's figure this out together. Even if we don't have answers yet, I know what you're feeling is real." To every patient out there, to every patient I've met, and the thousands I haven't, if you've ever walked out of a clinic feeling more confused, more unheard, more small, I'm sorry, but you deserved better. You don't need a diagnosis to deserve compassion. You don't need visible proof to justify your pain. You're not imagining it. You're not too sensitive. You are not weak. Your experiences are real. Your symptoms are valid, and you are not imagining it. Your pain matters, and healing starts with being seen. Please don't give up on yourself. Even if the healthcare system might have made you feel like giving up, I believe you can still find people, family, friends, healthcare professionals who listen. Your pain matters, and healing starts with being seen. Keep advocating for yourself. Keep speaking. And if you're tired, rest. But don't silence your voice. To fellow healthcare professionals, nurses, doctors, allied clinicians who are watching this video, I just wanted to let you know that you hold so much power, even in small moments. So before we assess, prescribe, or diagnose, or explain, we can validate people's concerns. And I promise you, it costs nothing to say, "That sounds really difficult," but it might be the thing your patient remembers the most. If this message resonated with you, whether you're a patient, a carer, or someone in healthcare, please share it with someone who needs to hear it. Validation is free, but it's powerful, and it might just change someone's life. For more videos that blend nursing insight with real mental health awareness and recovery support, I would like you to join me on this channel. Please subscribe as we talk about well-being, recovery, and the humanity behind health. Be kind to yourself. You are doing better than you think.